Good evening, everybody. Oh, thank you so much for joining me. I can't believe this is perfect timing. So it is October and it is Breast Cancer Awareness Month, and it is a perfect time to be talking about mammary cancer in dogs and cats. Tonight we are going to focus on dogs, but if you have your cat questions, I'm happy to answer them as well. So I try to do these about once a month. We did hemangiosarcoma last month, but this month is all about mammary cancer in dogs and cats as well. And next month, we're planning on doing cat mammary cancer as well. So thank you so much for joining me. I hope everybody is hopping on. And if you are, let's see who's here. And hopefully I can, let's see who's on and get some comments going. So they did change the software a little bit on my end, so there might be some technical difficulties, but hopefully not. So I'm super excited for everyone to hop on. We're gonna make some quick announcements and then get to your guys' questions. So hopefully I will start to see where they are. So let's see, if you're here, please be sure to drop a comment in, and hopefully I will be able to see where they are. So everybody just say hello, let me know where you are. And oh, there we go. I think that is better. Let's see. All right, so this is a link that will allow us to have guest people join. And I'm not seeing where everyone is, so hopefully, oh, there we go. Hey, Kara, that is Eclipse's mom. All right, so I'm finally seeing you guys. So if you could say hello and let me know where you're from, that would be awesome. Like I said, the software is a little bit new on my end, so I just want to make sure that everything's working before we hop on and get into the questions. So thank you so much, guys, for joining. I do, like I said, have a couple of quick announcements. So before, when I used to do these Q&As, I kind of used to do an overview, but to save time and to make it easier when you're looking for information on mammary cancer, I now have separated out that information. So I have 2 vlogs that have come out in the last couple of weeks on mammary cancer. And so at this point, new vlogs are coming out every Wednesday. So that is also my reminder to tell you guys, if you haven't yet, gone onto my YouTube channel, to check out my YouTube channel, because I have a ton of videos there on all different tumors. So 2 weeks ago, there was a video on canine mammary cancer, kind of just going over everything. So, what you see, what tests to expect when you go to your vet, when you need to do them, surgery, which dogs need chemotherapy. So we'll definitely go over those as we answer your questions, but just a pretty comprehensive overview of dog mammary cancer. And then last Wednesday, we had cat mammary tumors, and cats are definitely different than dogs, so you can check that out as well. And that was vlog number 92. And I've also spent a lot of time reorganizing my YouTube page to try to make them easier. So there's a whole playlist with mammary tumors, and you can find all of the dog and cat information. And then just tonight, a couple of hours ago, I dropped a new YouTube video all on chemotherapy side effects. I'm a little bit embarrassed. I got up to vlog 93 and realized I didn't have like a set video on side effects in chemotherapy. It was kind of, in lots of other videos, but kind of just go through everything that you need to know about chemotherapy side effects, hair loss, GI, gastrointestinal side effects, and white blood cells. So all there as well. And there's a chemotherapy playlist as well that goes through home safety with chemo, what to do when your pet doesn't eat. So I really have shifted in trying to make the YouTube channel a good resource of information of, different tumors and different things, how to pill a dog, all those different things. So please check out my YouTube channel if you haven't yet. And if you're there, I would be super excited if you would subscribe to my YouTube channel as well. And then you'll also get an email once a week when I drop new videos. And again, that is on Wednesdays at this point. And my dad just hopped on. So hi, Dad. Thanks for joining. It's always nice to have a little support from your family. So we are putting the playlist in there as well, and a link to subscribe. So that is all there. So it's great to see some people that I know join. So those were some of the things that I wanted to tell you about you know, before we got started. And another thing why we're just having people hop on is another good resource of information is going to be my website. And the thing that's going to be really helpful there is going to be the pet resource section there. And that's where you can find skin maps to find lumps and bumps and keep track of not only mammary tumors in your dog, but any skin lump or bump. And, you know, I'm a big advocate of once a month. And I think a great time is when you're giving your dog heartworm preventative or flea and tick preventative, of doing that, you know, tail to nose, nose to tail, it's been a long day, nose to tail exam. And I think it's in vlog number 73. I show you on my sweet little Penelope how to do a lump and bump exam, but it's hard to keep track and remember, was it right, left, front leg, back leg? So you can print this out. As you can see, you know, I have, you know, everything marked here, so you can keep track of all those lumps and bumps. And then, you know, you can use measuring tape, but you know, I have calipers and caliper pens and all these other things that you can get on the website as well. So that's all there. So again, and this is all really important when we're talking about mammary tumors, because you know, if you watch in the video and we'll talk, size is so important. And a tumor that is found less than 2 centimeters, which is this big, is going to be do so much better. Size is prognostic. So we need to find these tumors earlier. And guys, you're with your dogs, you're with your cats way more than your veterinarian than I am. So feel your dog, feel your cat. Dogs have 10 mammary glands, 5 on each side. So you have to feel them from armpit to, you know, the inner thigh area. And so it's really important that you're feeling your dogs once a month, keeping track of those lumps or bumps, and bring our pets into the veterinarian so we can follow up on any lump or bump. So that's really my spiel and my intro. In addition to the one where I do, you know, an exam for superficial tumors, we also have videos for mammary, for how to do a mammary exam as well. So a lump and bump exam of the breast area. So, you know, we often use the word mammary tumors for dogs, you know, but we're talking about breast cancer in dogs. And so again, this is a very treatable cancer in dogs, and early detection is so important. So I feel really, really passionately about early detection for breast cancer and so many tumors in dogs. So I'm so glad you're all here. And I think that was really the announcements that I wanted to make, was just that we've reorganized YouTube and that you can find a lot more information about mammary tumors and dogs and cats and chemo and things like that. So I would invite you to, you know, take a look. And if it seems overwhelming when you get to YouTube, check out vlog number 78, which is an overview of YouTube, of my YouTube channel. So again, I'm really just trying to make it as user-friendly as possible, because when your pet has cancer, that sucks enough. It should be, you know, finding information shouldn't suck, and getting as much information as you can should be as easy as possible. All right. So I think those are the things that, like I said, that I wanted to announce. I'm definitely, you know, if you guys have any questions about breast cancer, mammary cancer in dogs, you know, thank you so much. I see Deanna made it. So she's someone in the Metro New York area. So while we're waiting for people to hop on, I was going to announce this at the end, but I'm going to announce it as much as I can. So I am doing a free pet owner event in Tarrytown, New York, so Westchester, in my hometown. And this is brought by, and I'm pretty sure Kyle is here, so Dr. Kyle Stevenson is a vet who started a wonderful non-for-profit organization called Paws for Potter. And I think this is the 4th time that we're doing this event. We started in Watertown and we've been coming further down. So we started in her hometown, and we're doing a pet owner event about early cancer detection. So this time we're doing it in my hometown in Tarrytown. So Saturday, November 2nd, at 6 p.m., we're having a meet and greet, and the event starts at 7. And there, if you look at one of my recent Facebook posts or Instagram posts, you can get all the information, and there's links where you can sign up. It's free, but we would love if you could sign up so we know how many seats to have. So if you're in the Metro New York area, so the city, Westchester, Long Island, you know, New Jersey, Connecticut, we would love to have you join us. It's a great event. It's about hope and finding cancer early. So if you're in the area, we would love for you to join us. And just a huge shout out for Dr. Stevenson for putting together these events and our sponsors for helping us make this event happen and doing it all for free. So I would love to see you guys. Hey, Angel, it's okay. You're from Southern California. I don't expect you to show up at the event, but I know you would if you could. So thank you for coming to this. So I think that's it, guys. No questions? Anybody got any questions about mammary cancer? I'm just drinking water tonight, as far as you know. So let's see. Do we have any questions about mammary cancer? If not, you're just going to have to listen to me babble about mammary cancer in dogs, which I'm happy to do, but you know, I was hoping to get some questions. Let's see. I'm scrolling down, making sure I didn't miss anything. There we go. Kyle said it's going to be great, so please come. Okay, so Sue has a question. Let's see. I think I can show the questions. Oh, okay. So they, like I said, they just kind of changed everything. We use this DLive software, and so it's a little bit new, and so I'm figuring it out. So thank you for your patience. Just when I thought I had figured this out, but so Sue says, "What are your thoughts on spaying at 6 months before the first cycle and the lower chance of having mammary issues?" So this is a great question, and I'm happy to answer it, but I will also let you know that I have a vlog on this as well. And this is something that we continue to learn information about. I just want to pull up. It is, Danielle, if you could find it, I think I'm going to say it's like vlog number 62 or 60, but we can, while we're talking, Danielle can pull that up and put the link in. So, so we know that mammary cancer can be, the incidence can decrease by early spay. And so, you know, when I was in vet school, the thought was, you know, because we know that estrogen and progesterone, which are the sex hormones, can promote mammary cancer. So the idea was early spay, you know, by 6 months, and by a year, you significantly decrease the likelihood of mammary cancer. So it seemed like a no-brainer that every dog, you know, should have a spay before 6 months of age. What we have learned over the last, I don't know, maybe 5 to 10 years, and we're continuing to learn, is that there are some cancers that seem to have a protective benefit by leaving dogs intact, by having the sex hormone. So not just progesterone and estrogen, but also the male sex hormone of testosterone present. And so some of the examples where we've seen this have been like osteosarcoma. A lot of the studies have been in pure breed dogs, so like golden retrievers, and single breed studies. But in some cancers, it does look like there is a protective benefit. So lymphoma, mast cell tumors, we've also seen in Goldens a protective benefit of keeping dogs intact with some orthopedic issues like cruciate repairs. Mast cell tumors is another tumor that there seems to be a protective benefit. And so what I think is really interesting is a lot of those cancers are internal and harder to find. And the breakdown with mammary cancer is that 50% is benign and 50% are malignant. And half of the malignant ones are cured with surgery because they have a very low chance of metastasizing, and we don't usually recommend chemo in those. So 75% of mammary cancer is cured with surgery alone, and it's superficial. And if we do that monthly lump and bump exam and find them when they're small, dogs are likely to have a good prognosis. So that has really had me change my recommendations for high-risk cancer breeds and potentially any dog, and not recommend early spay and neuter for every dog. And so I think it requires that we have a conversation with pet owners. And I think if you have, you know, so let's use an example, like a Great Dane, you know, which is a high-risk cancer breed for osteosarcoma, I'm not sure that I would necessarily recommend an early spay or neuter in that breed. So Matilda, I'll give you my personal example. I was just learning this information right after I got her spayed at 6 months of age. She's now 10. Penelope, my Labrador, So she's 2 years of age, and I decided to hold off on her spay, and we just spayed her in like March of this year. And so she was, or maybe it was in April, it was right after I started my new job. So she was 2 years of age. So we let her go through about 3 heat cycles. And that was a decision that I made. So I feel like I can do my monthly lump and bump exam. I can find her I can find mammary cancer early, and some of the other internal diseases are much worse, the other cancers. And that was the decision that I made. You know, the question is, when do we do the spay? We don't know that. You know, most studies look like 2 or 3. I also know that if you keep them intact, they're at risk of other diseases like pyometra and other things like that. You know, we're still continuing to learn, and there's no right or wrong answer by any stretch of the imagination. So not a very simple question to answer. And I think you can put a couple of different doctors in the room and get very different opinions. We also know that pet overpopulation is a huge issue. So I'm, you know, not recommending that, you know, that shelters do not spay and neuter their dogs. And I'm still not recommending that you don't adopt a dog from a shelter that has been spayed or neutered. I think you just need to know the risks and the pros and cons. And I still see cancer in intact dogs, and I still don't see cancer in dogs that have had early spay and neuters. So again, nothing is going to protect 100%, but I think it's just part of the discussion that we need to continue to have and continue to do research and read studies and learn more. Okay, really long answer, but I hope that helped, or at least, I don't think we know the right answer, but I think it's worth considering delaying the spay and neuter, in my opinion, especially in high-risk breed dogs. And that's what I did for my own dog. So I think that says a lot in what I think. All right. Okay. So we did drop the, I can put it here, see if that works. So it looks kind of funny when you put it in there, but we do, like I said, there is the video from YouTube, when is the best time to spay or neuter your dog, and it talks about my journey with Penelope and why I made the decision, and some of the studies might be a little bit more succinct in that video, and then you get to see my cute little Penelope and her waking up from her spay and things like that. So we also did put a link to the free pet owner event on November 2nd at 6 in the it technically starts at 7, but come for the meet and greet at 6. So again, there's more information on that. And like I said, if you go to my Facebook page or my Instagram page and look at one of the top recent posts, you will see the information there with easy links on how to register for those events. So there, Angel asked a question, is there a correlation between canine obesity and mammary tumors? And I believe that there are some links. The studies aren't great in general. You know, a lot of them are just smaller studies, but I believe there are some studies that looked at obesity and mammary tumors. And I think in general, you know, keeping our dog lean is just a good thing in general, but I can't remember the studies, but I do believe there are a few studies that do have an association between canine obesity and mammary tumors. I know for sure there are studies that look at dogs that are leaner and they tend to live longer. There's a great study with Labradors that were leaner, lived 2 years longer. And if you think about it's like 10, 12 to 14 years longer. So lots of reasons why, you know, our dogs should be lean and not obese. So that's, but I'm not sure of the exact direct link with mammary tumors. Okay, so this is a great question from Dr. Stevenson, who said, do you recommend that each mammary tumor be aspirated like every other 1 centimeter or bigger mass? I've had some where they were non-diagnostic, questionable at best. And these, would you recommend or do a wedge biopsy like other masses? So this is a great question. And this is, again, something that continues, you know, that we're learning and evolving. But in general, I do recommend that, you know, if there's a mass along the mammary chain, that it's aspirated before you go to surgery. That, you know, you want to make sure it's not fat, because, you know, that would change. Maybe you don't need to take it off right away. It could be a mast cell tumor. And I've definitely seen other tumors in the mammary chain, because you have to remember that mammary tumors aren't always associated with the nipple, the gland itself. Sometimes they're in between ones. So I do think it's worth aspirating to show, is it mammary or not? in general, I was taught that you're not going to be able to tell if it's benign or malignant from cytology alone. There is a recent paper which, because I got a report recently that told me it was going to be a malignant adenocarcinoma from cytology, and I thought, you can't tell that from cytology, and they referenced a paper, and there was a recent paper that says you can tell whether it's going to be benign or malignant from cytology itself. So I do recommend it mostly for the reason to show that it's mammary versus non-mammary, whether it's mast cell tumor or fat or something like that, so you can prepare for your surgery. I personally don't find mammary aspirates to be less diagnostic than other cancers. You know, I think the ones that are most notoriously going to be non-diagnostic. So, you know, we stick a needle in it and then we send it to the lab, or we look at it ourselves and we don't see enough cells to make a conclusion, are going to be soft tissue sarcomas, you know, things like fibrosarcomas and things like that. But I think that, you know, just aspirate again, and, you know, for veterinarians who are questioning whether or not their samples are going to be diagnostic, I do recommend trying to look at a sample before you send it to the lab, just to make sure, you know, that it is, you know, has some diagnostic cells before you send it out to the lab. And Kyle, I like a 20 gauge needle, and, you know, Stacy's seen me do it. So Dr. Stevenson's nurse is my past nurse, who worked for me for years down in Yonkers and Westchester. You know, just always try to, you know, submit a couple of slides. But I would, if it is non-diagnostic, would I do a biopsy on it first? I think I would depend on the case and how big it was and what it looked at. I mean, you could do an excisional biopsy, see what it was, but then if it's malignant, you may need to go back and get wider margins. But again, knowing that half of these are benign, it's a little bit different than like a mast cell tumor where, you know, it's going to be malignant. So I think that's would depend, but I would just encourage you to do more aspirates and just try to, you know, they should be diagnostic. I think it's sticking more needles in them and just doing more samples of that mass until you get a diagnostic aspirate. Okay, glad that was helpful. All right, see if I can make that go away. I can. Let's see, so Angel said, okay, so this is great. So it's a good question. So Angel said, if diagnostic come back malignant for a single lump, do you remove just the one, or removal of the entire mammary chain is indicated? This is a great question. And this is actually a huge difference between dogs and cats in terms of the surgery that you need to do. So one of the similarities between dogs and cats with mammary tumors is that 50% of dogs and cats will have more than one mass, more than one mammary mass at the same time. So if you're a pet owner and you're listening and you drop your dog or cat off for surgery, don't be surprised when they're shaving your dog or cat if they say, we found a second mass, because again, sometimes they're small and that's when they'll find the second one. In dogs, you need to do a lumpectomy. So you just want to, and you know, often, so like I said, in general, most of the time from cytology, you're not going to know if it's benign or malignant. It's just going to tell you if it's mammary, that it's mammary. So usually I recommend, you know, trying to do a big surgery and getting margins so you don't have to go back and get, you know, bigger margins. So you just want to, you know, go, you know, outline around it and go around that one mass. If you have two mammary tumors in adjacent mammary glands, you're going to do that as one, you know, bigger surgery. If you have, sorry guys, I always have to point, like if you, I guess I can point on the dog. I don't know if this will be as effective, but if you had one up here on this side and one down here, you would just do one up there and then one down there. But if you had a couple right here, you could just do one big surgery on the dog, you know, and remove it. But the goal of the dog is just to remove all of the affected tissue. You do not need to remove the whole chain in the dog. The only sort of exception is in Europe, where they don't typically spay the dog. Then you typically will do a whole radical mastectomy because you're leaving the dog intact. And that is a good thing to remember, that it is been shown to be beneficial if the dog is intact. They have not been spayed at the time that the mammary tumor has been found. If it's malignant, we do recommend that they be spayed at the time of that surgery, or you go back and then they come back in a couple of weeks and get spayed, because that has been shown to be positively prognostic. So the dogs will live longer because, again, you're removing that source of estrogen and progesterone, which can promote these tumors. So Angel, to answer your question, you just need to remove the affected lump or lumps, and all of them need to be submitted, because a dog can have one benign and one malignant at the same time. So if you just remove, if you remove 2 lumps and just say, to save money, I'm just going to submit one, and you submit the benign one, you may not find out about the malignant one, and that may be the one that the dog needed chemotherapy. So remove all of the affected lumps and submit all of them, because, again, they can have concurrent benign and malignant ones at the same time. This is different than cats. Cats have, and I said 50% are malignant in dogs, 80 to 90% are malignant in cats. And in cats, the first surgery should be a radical mastectomy, where you're taking off the whole side. So very different. You need to take a much bigger surgery. And I actually, just posted that video last week, and I just posted it to IGTV, and I said, what is the biggest mistake that I see with cats? And it's cats that come in with a lumpectomy, and then we have to go back and do a radical mastectomy in cats. So cats are very different. They need a bigger surgery the first time. So again, dogs, you can just remove a single lump. You don't need to remove the entire chain. Again, if you're listening in Europe, it's a little bit different, but again, we do recommend in dogs that you go back and spay those dogs afterwards if they have not yet been spayed. Okay, long-winded, but long-winded questions, I guess, but it's still good questions. All right. So any other questions? We're coming up on the half-hour mark, which is always a good time to sort of check in, see where we are. I'm going to make sure that I didn't have any other announcements. I will remind people if they are interested in the calipers, Dr. Sue 2019 is a code to get 15% off. We have digital calipers if you're a veterinarian and you like those, which are in my little magic box over here of all my goodie stuff. So those are the digital calipers, give you accurate measurements. So if you're interested, those are here as well. But if you're a pet owner, I think the plastic ones are good. I happen to be obsessed with the pen ones. If you watch any of my stuff when I'm traveling, I'm usually measuring stuff as well. So these are really good to keep track of your pet's lumps or bumps as well. And Angel said, thank you. Absolutely answered my question, and new info for me on cats, which is great. So Angel, definitely check out the dog and cat vlogs as well, which just went on YouTube, because that will, reinforce the information as well. So again, those are those codes on there. And just as we're talking about lumps and bumps, and, Dr. Stevenson, just to bring it up, it's just a good point, she said about the 1 centimeter. So my lumps and bumps program, if you haven't heard about it, I just usually like to mention it once a Q&A. So see something, do something. So if you see something or feel something, if the mass is the size of a pea and been there a month, I want you to go to your vet and get an aspirate. And guys, a pea is 1 centimeter. So really, really small. That's really the indication. If it's size of a pea and been there a month, I want you to go to your vet and get an aspirate, whether it's along the mammary chain or anywhere else in your dog. So if you watch the video on dog mammary tumors, when they look at size that was prognosis, the size that did the best is 2 centimeters, and then 3 centimeters, and anything bigger than 3 centimeters, which is not that big, I always say is about the height of my glasses, we start to get into worse prognosis. Still treatable, but again, that's where size is important. It's not the only thing that is important. Some of the other things that are important that I go over in that video are, whether or not it has spread to the lymph nodes, whether or not it has spread internally, so to places like the lungs or things that we look at on an ultrasound, so the liver and things like that. So really important why early detection. So size is important, lymph node and things like that. So we go through that. And then other things that I look at on the biopsy, the type of mammary cancer that it is there vascular lymphatic invasion? So those are all some of the things that I'm going to look at when I'm trying to decide which of those 25% of all the dogs that have mammary tumors might benefit from chemotherapy. So that's really part of the process there as well when we're trying to go through these tumors. But, the take-home message, I think, with mammary tumors is that they're treatable cancer. Like I said, 75% of dogs, the good news is they don't need chemo after surgery. Again, it's just really important that we find them when they're small. So again, we as pet owners just need to take that responsibility and find these lumps or bumps, you know, find a system to keep track of them with, you know, skin maps and things like that. And then if you're ever concerned, go to your vet, make an appointment, and, you know, get an aspirate. It's a great, simple, easy, non-invasive test, minimally invasive test that's done awake, they're not sedated, and things like that. So it's a great, great way to, you know, be an advocate for our pets' health. And that's really what this is all about. All right. Any other questions? I don't think we've ever finished so early. Very exciting, though. Make sure I didn't forget anything on my end. I don't think so. Guess I'm just going to put up the free event again because I'm so excited about that. And so thankful for Dr. Stevenson for putting this together. I hope some of you will join. Anybody have any cat questions out there? I know this is supposed to be about dogs, or any other questions as well. I'm happy to answer them. I'm trying to think of some of the common questions that I get about mammary tumors, because we do get a lot. You know, also this month on Facebook, if you know, have seen them, we have some, we've updated them, my infographics on mammary tumors. So I think like 4 days a week, we have a new graphic that comes out with information as well. So that's another place to get good information. So I'm just trying to throw lots of information at you, you know, some of it in video form, some of it in pictures and text form and things like that. So, you know, I'd love to know which are the ones that you like best. Do you guys like the Facebook graphics? Do you like the YouTube videos? That actually would really help me, you know, help you. So if you want to throw a comment in and just let me know what works for you guys, that makes me happy as well, because I spend a lot of time on these things. And so it really helps me, you know, and if you, different topics and things like that. So if you guys want to make some comments and let me know what is, you know, the good things that you like and what are the things that aren't that helpful, that always helps me as well. Angel wants to know, Angel, I'm actually trying to work on coming to Southern California maybe next fall in 2020. So stay tuned. Of course, you will know as soon as I know. Kyle, thank you for joining. She said, thank you so much for the Q&A. Can't wait to see you in about less than 2 weeks. Let's see, we have another question. Let me take a look at this one. Okay, so this is a little bit of a long one. I'm going to read it as I go. So this week I was a dog presented for spay. I had been diagnosed at another clinic with mammary adenocarcinoma, so malignant form. It was to start chemo in 2 days. I declined to do surgery because I felt there was a high risk of delay wound healing. Do you disagree or agree? So I guess, Marvin, are you asking, is the question not to do the spay because it was supposed to start chemo in 2 days? I'm guessing. You know, my question, if that's the question, you know, so I would prefer that the dog not start chemo 2 days after a surgery. I would usually, you know, I have had cases where I would prefer them to delay chemotherapy, you know, for 2 weeks. Usually we like for it to be 10 to 14 days before we start chemotherapy after surgery. There's been exceptions to the rule for things. I have had cases where I've had to do surgery in the middle of chemotherapy for different reasons. And so what I'll often do if I'm doing like every 3-week chemo is I'll have the dog come back in a week, make sure that its white blood cell count is not low from the chemo a week before, because lots of dogs will have their nadir, their low white blood cell count, a week after chemo. We'll check blood work, and then as long as the blood work is good, I'll send them off to the surgery team to have their surgery. And then that's perfect, right? Because that's 1 week after their chemo. They're not due for chemo for 2 weeks. And then that gives them enough time for the wound to heal and the sutures to come out and things like that. So I think that would be a more reasonable approach, is to talk to the clinic that's doing chemotherapy and see if you could coordinate it. But yeah, I would prefer the dog not to have a spay and then get chemotherapy 2 days later. I just think that's pushing it. I would try to coordinate its surgery a little bit better with the whoever's getting the chemo, the oncologist, the veterinarian. So I agree with that call. Like I said, I've had some cases where I've had to give chemo a little bit closer, but usually they're lymphomas, and we've just careful about, there are a few chemo drugs that don't inhibit wound healing, like vincristine, but that's not usually considered to be effective for mammary tumors. So yeah, so he's saying yes. So it sounds like I'm on board with that question or with my answer. So good call. I would prefer to delay chemotherapy or just time the surgery better. So I like how you were thinking, and I think that was a good call. So excellent. So I just put that up. I didn't put that up again. Like I said, figuring out this new technology. But I think I did okay tonight, right? Not too bad. So again, guys, let me know what you like in terms of YouTube, the infographics. If you're like, I don't even know what infographics you're talking about, go over to my Facebook page. Just scroll down. You'll see every couple of days, like I said, almost every day, I think 4 or 5 times a week, we have infographics. Do you like the YouTube videos? Do you have new topics that you want? Are the videos too long? You know, do you want them shorter? I would love feedback about that stuff, because I'm doing this stuff for you guys, and it's the only way I can get better is to hear from you guys and let me know what you like. So I think that is about it, but I would love for you guys to drop some comments in there, a little bit of feedback for me. I really appreciate you guys always turning out for these events. Again, check out YouTube. I think you're gonna, if you have a pet that's going through chemotherapy or gone through chemotherapy, I think tonight's video will be helpful. But it definitely, the mammary video, vlog number 91, I think is a good overview of mammary cancer. So that is a good one if we can just drop that one in. But that's vlog number 91. If you just go to the playlist, it's going to be 3 vlogs back because we're on 93 at the mammary cancer as well. Amanda's asking a question, which I said is fine, off topic. So how do we treat the skin from the swelling of bone cancer? So I don't know that I can answer that question specifically without seeing the patient. That's going to be one that I'm probably going to say you're going to need to see your veterinarian, but I'm not, it could be that there's an infection underneath, could be that needs an anti-inflammatory, and which one's going to be safe for your dog is going to depend on what else is going on in your dog. But a lot of the times they just have a lot of swelling just from the bone tumor itself, usually not from infection. So if the skin, it could be because they're licking at it, could be getting a secondary infection or things like that. So my big advice is to see your oncologist, see your veterinarian, have them take a look at the skin, see what's going on, and then decide, do they need an e-collar? Do they need something to cover it? But what's going on? So those are the things that I'm thinking, but clearly you're going to need to see your veterinarian. I wish I could help you more, but some things are just not right to do. So again, definitely check in with your veterinarian or your oncologist and bring your dog to them. So I do have a good number of videos on bone cancer as well. I think there's 3 videos on there, but they don't specifically talk about that because that sounds like something that you're going to need to see your vet for. All right, we did just put in the mammary cancer link as well. So again, I know that's vlog number 91. Like I said, pretty comprehensive overview of mammary tumors. Hopefully, if I missed anything, or if you have more questions about chemo, or just what signs you see, or just what's prognostic, like I said, I go through that in pretty good detail. All right, guys, we're coming up on 9:40, and I did tell my kids that I would tuck them into bed, and I think that is a wrap. Thank you so much, guys, for joining. Like I said, next month is cat mammary tumors. A little bit of a different beast. They're definitely more aggressive, higher malignancy rate, and higher metastatic rate. So, the take-home messages in cats are a bigger surgery. Most of them, do get the recommendation of chemo, and all cats should be staged before they go to surgery with chest x-rays and ultrasound, a little bit different than dogs. So again, if you have more questions, check out the videos. Thank you so much for joining. Don't forget, is anybody going to come besides Dr. Stevenson and I? Don't forget the free event in Westchester, Tarrytown. It's the Westchester Marriott. Like I said, definitely look for the links on my Instagram, YouTube, or Instagram and Facebook. Guys, please subscribe if you have not yet on YouTube. That would make me very, very happy. Thank you so much for joining. And I will see you guys next month, and have a wonderful evening. And I'll see you guys at the next video. Bye, guys.